All right, everybody, welcome back to another episode of the Discovering Multifamily podcast. I'm one of your hosts, Anthony Scandariato, here with Red Knight Properties. And today we have a very special guest here with us, Dr. Alex Tam, coming at us from Nevada. And he is a chiropractor, and his company, Zephyr Equity Group, helps healthcare professionals achieve financial freedom. And we talk about that a lot on our show through multifamily investments. And, on this show, we're going to talk about how, Alex is a pretty established chiropractor and clinical director at a successful integrative medical clinic. And he's written a book before, and, he's had a lot of success in the healthcare industry. And, it actually his success enabled him to have some, um, you know, basically kind of losing some time because he just kept getting more busy and busy. So Alex was trying to figure out how he can achieve more freedom and more to free up more of his time through different types of investments. And that wasn't really exposed to him until somewhat recently in multifamily real estate investing, and how it's efficient to partner with a group or to partner with individuals, especially if you have somebody running the show. And obviously doctors of all sorts of stages are very busy, and even small business owners um, to invest in alternative asset classes. So really excited to have him on the show, and thanks for coming on, Dr. Tam.
Anthony, thank you so much for having me.
Awesome. So yeah, so talk about, if you could kind of talk about what was the light bulb that went off in you. Obviously you've been doing this for over 15 years as a doctor, but how did you find real estate?
I went to a Grant Cardone conference, believe it or not, back in 2018, mainly for my business. And that was the first time I ever heard about syndication. And I thought, wow, you can invest as a limited partner and not have to do any of the work. Because at the time I had a rental. And this rental, we were driving back and forth, trying to get, talk to the contractors, the realtors. And even though it wasn't, it was pretty easy, it was just I still have to do the work, right? For about 1.5% cash flow compared to what I put in. So the
Mm-hmm.
cash on cash was really, really low. And when I heard about syndications and multifamily, I thought it was just a no-brainer. So I started investing from 2018 to 2021 passively. And in
Mm-hmm.
2021, became very active, got into the Jake and Gino educational group, and really started learning a lot on how active, the active roles as an operator in multifamily, how to raise, how to asset manage. And we started bringing other doctors on board as well.
That's awesome. So, okay, so you went from passive, from active to passive, and now back to active. So a little bit active, and I'm sure you have some passive as well. Um,
Yeah.
how how is the active now in terms of your time as a healthcare professional? Because I've talked to other doctors and healthcare professionals that they actually want to eventually get out of medicine and pursue something else like real estate. But again, they don't really have the time during the day to, um, pursue real estate. So it's interesting to hear that you went back to active. So how does like your team look now? Is there established roles that you have that can allow you to, still practice medicine and invest in real estate and still be sort of involved or
Oh,
or very
absolutely.
involved? Yeah.
Absolutely. We're still very involved in real estate because in the practice, I still want to continue to grow my practice. We have a couple other doctors in the practice. We have a few staff members to really take care of all the patients here. I'm in the office a few days a week as well as I get more out of the practice and work more on it instead of in it. We do plan to open multiple practices in the long run. So, but real estate is something where my strong suit is investor relationships, do some asset management, capital raising as well. So we do have other team members who are boots on the ground underwriters who can handle the financing construction. So we really work as a team. So it doesn't take that many hours out of my day. I'm not like a solo player in it because real estate is really a team sport, right?
Yeah, no, absolutely. Um, and can you talk about what healthcare professionals are typically exposed to? Because obviously you're dealing with private placement investments. So what have you been used to for the past 15 plus years in terms of investments?
Oh, usually doctors are just exposed to IRAs, putting money in 401ks, self-directed 401ks, putting money in stocks. That's about it. No one really teaches doctors how to run a business, let alone invest, right? So the investment side, you really have to learn it. And when I start talking to doctors about how the tax benefits, the appreciation, the cash flow, I mean, they're like, wow, it's unbelievable. I didn't even know something like this existed when I first found out. So I would only imagine other doctors when I tell them, they're just in awe.
That's awesome. And talk about some of the properties, some of the markets maybe you're in that you've been able to acquire with this group.
Yeah, ultimately we are in a different areas. We like the Midwest, um, Omaha, Indianapolis, Cincinnati. We're in Waco, Texas as well. Good cash flowing properties that are like class B properties is what we have been focusing on. And lately we have been looking at some class A's as well. So it's one of those things where we like to diversify to make sure that our investors are being diversified as well, so that we're not always focused in one location necessarily.
Yeah. And because I work with some healthcare professionals, including doctors, and
Hmm.
obviously typically very, very smart people. Um, are there, and I get a lot of questions probably from doctors.
Yeah,
It really comes down to a trust level at the end of the day.
yeah.
But what kind of resources and obviously you're well respected in your field, so it might be easier for you, but what kind of resources do you have for healthcare professionals that know, they went to 8 years of medical school, sometimes more, and they just never studied finance? Like, how do you get them comfortable in investing in this, alternative asset class where maybe even they come from a family of doctors and they've just always maxed out the 401k and the IRA. What kind of resources do you provide them?
That's a great question. I believe that one of the upper hands we do have in our team is me being another doctor. I attend the same conferences that they do. We belong in some of the same groups that they do. So automatically there's some form of trust. They know that, they know how our practice is ran on the medical side. So with the trust being built right there, the resources then is just showing them our webinars and our tear sheets and the pitch deck on what it is. And the fact that of the matter is that this is what I've done, right? We're not chasing after them, because the ones who are already interested, they're going to come to you. And those are the ones that have came to us and that have reached out to us and that have said how interested they were. And it's just a matter of here's what the deal's like. If you'd like to invest, then let's do it.
No, that's great. Um, and yeah, and I'm sure that, like you said, you're in the industry, you've been in it, so it's a lot easier in that respect, and you kind of
Right.
have a focus on that, which is great. Is it only multifamily, or are you investing in other real estate?
Well, right now it's multifamily only. Yeah, I'm not opposed to looking at anything else. It's just that's just been our focus, and it's what we know, what we know how to underwrite. So that's what we focused on.
Yeah. Because I know some other operators, they start out in multifamily and then, especially, with your healthcare background, they start looking at medical facilities and whatnot. So that's why I ask. I don't know if you considering expanding, but it's always to do what you know best.
Yeah, right now we're focusing on what we know and not trying to, when we're talking about other people's money and even our own money, we're not going to try to play around with that much.
Yeah, makes sense. And so in terms of the properties, so you mentioned you're in a few markets. How do you mentioned earlier when you
Mhm.
started out, you were managing your own property, and at the end of the day, it was like a 1% cash on cash. So how are you managing these now? I think you mentioned 4 different states?
Yeah, we have a phenomenal team. There are some self-managed. There are a couple of them where one of my partners has a property management company, so they're in it, right? And it's great. I love the ones where we are self-managing, and there are third-party management. Those could be done better depending on which property management we're talking about, right? So it really depends. And that's how we manage them ultimately, is that we have great boots on the ground over there.
Right. No, that's great. No, I was just wondering how you were managing those. And in terms of the unit count sizes, what are you guys typically focused on?
Gosh, we have ones that are in the 50s, one in the 90s. So right now with the market the way it is, it's as long as it makes sense. We like to focus on 30, 50 and above, right? We've been looking at acquiring ones that are in just over 100. We looked over one that was in the 200 unit range, but during due diligence and the walkthrough, it just didn't make sense. So we walked away from that one.
Hmm.
So yeah.
It's good to know when to walk away as well. Um, so you're focusing, so it's really 50s and up is what you're focusing on moving forward.
Right, right.
Oh, that's great. And you also run a podcast as well, correct?
Yeah. Our podcast called Life by Design Through Real Estate, because it's made such a significant change in my life, right? That it's something, once in a while we might talk about health. We're looking at doing like a branch on just health alone,
Mhm.
right? How do you design your life through being healthy? I realize a lot of real estate investors, they know real estate, they have no clue how to take care of their bodies.
Mhm.
And we're going to hit that point as well. And hopefully we could speak to some real estate investors to make sure that, yeah, you might have passive income and income coming in, but if you don't take great care of your body, and just like an apartment complex, it's going to, break down.
Yeah, that's a great metaphor. How could people find that podcast? Is it on iTunes?
It's on iTunes, it's on Spotify, YouTube, if they want to watch the videos. So
Yeah, well, I'll have what I'll do is I'll put in the show notes a link to the podcast, iTunes description, etc., so people can check it out. And
awesome.
yeah, how can my audience find you, learn more about you, and connect with you, and kind of learn about what you're doing? What's
Yeah,
the
one of
best
the
way?
best ways to connect with me is through LinkedIn. So they could just find me, Alex Tam, on LinkedIn, Facebook. They could reach out to me on my cell, 775-717-0090, and just hit me up, and then we could start chatting.
That's awesome. Well, Alex, thank you so much for coming on the show today. Again, for my audience, if you can leave excuse me, a rating and review on iTunes, it would help our message get out to a greater audience. That's just the way the algorithm works. So I would appreciate that. And definitely connect with Alex on LinkedIn. And also, I'll put that cell phone number as well in the show description. So you can reach out to him and learn more about what he's doing. So thank you so much for coming on, Alex.
Wonderful, Anthony. Thank you so much for having me on.